Hello, I'm EHRs Chanelle, and today I'm going to discuss about electronic health record. Electronic health record introduction. According to the New York Department City of Health and Mental Hygiene, electronic health records are computer systems that medical practices use instead of paper charts. All components of clinical practice are integrated into electronic health records, from assessing a patient's chief complaint to developing a treatment plan. Everything that used to be handwritten by healthcare providers and staff is now entered into a computer directly into the electronic health record. Electronic health record does not only deal with care-related work of patients, but also helps in the management of the daily activities of the practice. This includes scheduling features, multifaceted calendars, and appointment reminder systems, and functions for billing and sending claims to insurance companies. Electronic health records can combine all of these features in one system. Two components of electronic health records that support direct clinical care. Clinical component. The clinical component has a number of subcomponents, including computerized order entry, CPOE, electronic documentation, nursing components, and others. The computerized provide order entry, CPOE, is used by a provider while entering orders that are needed for patient management directly in the computer. It can help to make sure of clinical decision support tools such as drug allergy, and drug diagnosis interactions. It also allows providers to enter multiple orders from order sets. Electronic documentation is used by providers and allows them to read different notes such as history and physical consults, discharge summaries, operative notes, and others. The nursing component allows to collect patient information such as vital signs, input and output. It also allows for medication administration record, MAR, barcode medication charting, and nursing documentation. Laboratory components. Lab components are mainly divided into subcomponents, capturing results from lab machines and integrations with orders, billing, and lab machines. The lab components may either be linked with the electronic health records or may exist as a standalone. This means independent or single product. Benefits of the two components that support direct clinical care. Replacing paper-based medical records which can be incomplete, separated, hard to read, and hard to find. Providing a single, shareable, up-to-date, accurate, rapidly retrievable source of information that can be available anywhere at any time. No need of using a big space, and they help to save administrative resources. Ability for automating, structuring, and streamlining clinical workflow. Offer integrated support for a wide range of disparate care activities such as decision support, monitoring, electronic prescribing, electronic referrals, radiology, laboratory ordering, and results display. Issues of the two components that support direct clinical care. Need of using consistent standards such as medical terminologies and high-quality data to support information sharing across wide networks. Ethical, legal, and technical issues linked to accuracy, security, confidentiality, and access rights that are becoming so many as technology is evolving. Clinical information standards and communications protocols that need to be followed. Need of providing patient data quality data sets, data dictionaries for a good understanding for the reader. Let's talk about two components of electronic health records that support administrative processes. Patient management component. This component is used for patient registration, admission, transfer, and discharge functionality. While registering patients, they record key patient information such as demographics, insurance information, contact information, and others. When a patient is recorded for the first time in an electronic health record, a unique ID called medical record number is generated. Billing system. The billing system is used to put together all charges generated in the process of taking care of patients. These charges are gathered together to be sent to insurance companies, tracked and completed. Benefits of the two components of electronic health records that support administrative processes. Easy process of recording and identifying patient information. Easy to capture, maintain, and manage the patient demographic information. Billing system is easy and fast. Issues of the two components of electronic health records that support administrative processes. Errors in billing. Issues between insurers and providers in case of errors. Difficult terminologies. Lack of training of providers to use those components. Extensiveness of the systems. Importance of the integration of administrative and clinical areas for effective use of an electronic health record. Mainly the importance of integrating electronic health records in an administrative and clinical areas resides in the way of facilitating the workflow between departments, the reduction of errors, and in the reduction of errors and in time and money savings. Here are some points that show the importance in detail. Healthcare providers can order and receive lab tests and diagnostic images electronically, thus making processes easy and fast. Reducing medical errors in a way that electronic prescribing application alerts healthcare providers if the proposed prescription could provoke an allergic reaction or an adverse drug event. Reducing medical errors while reading prescriptions, given that all progress notes are typed or dictated into electronic health records. Facilitating population-level health management in a way that important patient demographics information is stored in a structured way. Electronic registries for disease management allow practices to stay updated with specific guidelines when treating patients with chronic diseases, allowing practices to get financial gains in a way that electronic health records allow to indicate the services provided quickly and efficiently with electronic super bill functionalities, allowing practice to reduce storage of paper charts, saving space and money, and so on. Thank you.